racist thinking becoming reinforced with a kind of scientific racism. And to get around that, to avoid that, it's much more sophisticated thinking about what we mean by culture and how our ways of life are partially shaping our brains and partially residing in the way of life that we have to participate with each other in. So to get neuroscientists to think that way, that's the project of this critical neuroscience group based in Europe, is try to get neuroscientists to do more sophisticated research where they don't take 7 Westerners and 7 Asians, but maybe they do ask something about, okay, you have this diet or you have this aspect of your child rearing, something a little more specific we're talking about now, and let's see how that plays out in certain ways, and we trace that developmentally and neurologically in some ways. That could really teach us something.
Yes.
Mental health is more than any other ailment of the human body. I think it slides under the radar of the health systems because it's a burden that's often borne by a family without presenting. And from any of the panel, what are some of the barriers to people presenting with mental illness, barriers to compliance, and what are some roles for law and policy to loosen those barriers and allow people to present?
Well, obviously this goes beyond economics, but clearly stigma plays a role in this, not just fear of the perceptions of others, but also self-stigmatization, feeling someone with guilt, etc., that keeps one from coming forward to the doctor, for example. What can be done about that? I think the main direction is the kinds of anti-stigma campaigns that we're starting to see. In the UK, there's a big push right now to try to reduce stigma. I think this is part of the agenda of the Mental Health Commission of Canada as well. So people who know that literature better than I could address more specifically what are the ingredients of anti-stigma campaigns most likely to be effective.
Just to speak to very briefly, we did a study in the Côte d'Ivoire area some years ago where we interviewed 2,400 people and looked at their reasons for not going for help if they had mental health problems. And number one reason was they felt they wanted to deal with the problem on their own. So there's a sense that for the less severe end of the spectrum, people feel it's more of a moral issue, more of a personal or family issue, and they're not accustomed to bringing it to clinical care. But one of the other major factors was stigma, and the Mental Health Commission of Canada definitely stigma is viewed both as a public education issue, but also as a human rights and legal issue in terms of targeting the areas where stigma is being enacted in some way and prohibiting that.
Well, I have to say, as a family doctor, it's a lot easier to get a patient treated for breast cancer or than to find a psychiatric specialist to help you. If my patient is having angina, put him in the cath lab tomorrow. If you need a psychiatrist, you can whistle.
Yeah, I just have a question, I guess, sorry, did I cut someone off? A question for Dr. Latimer. I take your point very well that there perhaps is an increased role for ethicists in designing public policy. But do you think that ethics, and by extension ethicists as an enterprise, are up to that task? Is ethics really designed to get involved in political affairs and actually decide what is right and what is wrong? Or is it more just to raise certain questions, and is there a risk of ethicists perhaps getting co-opted for political ends?
Well, thank you. I think that's a very good question, and I was aware as I was kind of making those suggestions about giving a more systematic and explicit role to ethical discourse in all these levels of policy making, that there were some risks. At the same time, I think we're in a situation right now where there isn't the kind of ethical scrutiny of a lot of decisions that have very significant impacts on people encountering the healthcare system that we're giving to healthcare research projects. And it seems to me that there's an odd imbalance there. And we've been making some progress in figuring out how to make ethics committees less burdensome and sort of gradually learning how to make ethical reflection influence how research is done in a reasonably efficient way. I think we have a lot to learn in trying to make those same kinds of advances and thinking about the various levels of the healthcare system. So I'm not saying it's obvious, but I think we need to move in that direction. And frankly, I think ultimately we will.
That's right.
Perhaps I'd like to say something here in terms of what I was talking about, the anthropocentric and the cosmocentric approaches. I think there is when we're talking about mental health, there is a basic, when I say myth, or a belief, okay, in the anthropocentric way, which is that the psyche and the soma are two distinct things. Body and spirit are two separate things, and it's a fundamental Cartesian inherited belief or conviction or postulate, whatever you want to call it. So I think in this discussion about culture and disease, I find it essential to question as well that myth, not only just about mental health, it may give us some keys about mental health, but also about what we call the medically unexplained, because we see them. In your papers, which I keep quoting, there is a high percentage of the medically unexplained. Okay, whatever we do, like pain, we do MRIs, we go as far acutely and minutely examining, and we can't explain it. So we may want to, at this point, as we're moving to such great technology, perhaps question the fundamental belief, postulate, psyche, soma. That's not what the cosmocentric approach says. It's one big blob.